Nwoya District is a beautifully fertile region in northern Uganda, where the local economy runs entirely on farming. This visualization shows a stark economic divide. While 87% of households depend on agriculture, 45.7% of the population lacks consistent access to food. That gap leaves 1 in 4 children in the district suffering from stunting. Stunting is a condition where chronic malnutrition impairs a child's physical and cognitive development, often permanently. Producing food does not guarantee that a community is nourished. Without mechanisms to protect the harvest, the agricultural system fails to feed the people who work the soil. The system breaks down at the household level during the lean season. The lean season is the period between planting and the next harvest, when stored food supplies are exhausted. Families facing empty pantries often resort to distress sales, selling their future food supply at low prices for immediate cash, or they are forced to wait for external relief distributions. In the past, the district relied on voluntary guidelines, but when a family is hungry, advice to save food fails unless it is backed by structural support. This vulnerability marginalizes women, who are frequently excluded from financial and food purchasing decisions when resources become scarce. Resilience against seasonal scarcity requires enforceable, localized safety nets to ensure food remains in the home. The CASCADE project partnered with the Nwoya local government to turn passive observations of malnutrition into district law. This chart shows the gap CASCADE identified. Using the 2023 District Nutrition Coordination Council, or DNCC, assessment, the project showed leaders that national nutrition policies failed to reach local households. To bridge this gap, 11 sub-county consultations brought over 150 citizens into direct contact with their political leaders to share their experiences of food insecurity. Women-led organizations and civil society partners mobilize around these testimonies, demanding that the district council codify citizen needs into law. Policy is effective when it aligns hard data with organized citizen demand. These efforts culminated in December 2024, when Nwoya formally adopted the Food and Nutrition Security Ordinance. The first pillar mandates household reserves, requiring farming families to stockpile diverse foods for the lean season. The second requires mutual consent. Husband and wife must agree before selling reserves. The final pillar mandates 10% of local budgets fund nutrition coordination. By codifying these community protections, this ordinance transforms nutrition from a mere charitable goal into a legally binding permanent standard of living. In 2025, the focus shifted to the ordinance's operational rollout across the district's departments. This legal framework forced 13 different development partners to integrate their budgets and activities into one unified district plan. That alignment expanded Village Savings and Loan Associations, or VSLAs. These are community-run groups where members save money together to provide each other with small loans for household investments. Legally binding policy changes unlock and organize resources for the most vulnerable households. The Nwoya model now serves as a blueprint for Uganda's National Development Plan, scaling local resilience into a national framework. This local success clearly demonstrates that grassroots legal empowerment is a highly scalable, permanent solution for long-term global food security. Sustainable food security is achieved by engineering permanent, self-sustaining rights. Resilience begins with local ownership. Concluding tone. This project was led by CASCADE in partnership with CARE and GAIN to strengthen policy for healthy diets and resilience.